My name is Albert KAMANYI. I'm a university professor in Cameroon context, now emeritus. I'm stationed in the United States in Washington, and I was given the opportunity to talk on the medical and healthcare risk in relation to the COVID-19 pandemic. I try to explain the ethical controls, the ethical complications involved in the coronavirus as far as medicine is concerned. And this is a respiratory problem which can take the life of an individual in a very short time. It is a very, very strong and degrading pandemic which the world is trying to fight against. And what is medicine going to do about this thing? Most of it has been more of preventive, in which case they talk of face mask, social distancing, washing of our hands and wiping with soap and clean water all the time, and keeping our distance with individuals, trying to be as clean, as hygienic as possible. Then right now, since there is no cure that is looking very, very promising, vaccines have come out to be the option that some people must have to take. Countries are taking different steps to force their population to do this vaccination, to take the vaccines, because the prevention is usually the best medicine. People are so skeptical about vaccines, but the truth about vaccine is that it has its own advantages in a pandemic for which we have not been able to find enough material to treat. Because science is evolving, the ethical aspect of it is going to an extent where today in the scientific world people are talking about reducing the pain or the pains mothers will go through after conception. They are thinking of producing an artificial uterus, and where the fertilization will be done in vitro process, in which case they will try to follow up the lady and make sure they fall on the period of her pre-estrus and extract a day or two after the ovule that is being released by the ovary. This one is put under a condition in the test tube, which are exactly the same. The conditions are the same as those of the female system. The same procedure will be done to extract the semen from the men, from which they can extract spermatozoa. Fertilization will be done in vitro, and the artificial uterus will be used as an implantation site for the fetus to grow. After 8-9 months, the baby will be ready, and they will produce a new baby and show the family, because they don't want to get the women to be suffering very much. What the ethical complications, the ethical implications of this kind of suggestion is whether it is going against education, it is going against religion, it is going against even normal social relationship. What is the reason for a man clinging to a woman to make a couple? Usually, when they produce and they produce babies, it is through sexual intercourse, and the mother carries the baby or the fetus for 9 months. Today, they don't want to get the lady suffer or get her system degraded, but they will give her the possibility of just removing the ovule from her and having an artificial fertilization outside the uterus. So the mother will be as if she's never carried any baby for 9 months. What are the ethical implications for this type of procedures? Are we sure the baby you carry will be your own? Are you sure of the safety or the seriousness of this artificial insemination in that laboratory or in that artificial uterus? Many ethical questions can be posed. Then we look at it from the African and European mentality. Will the Africans take this kind of procedure easily?